Next speaker has a number of different titles and graduate degrees. I won't go through all of them, but Dr. Henry Xiang is a professor of medicine and epidemiology at The Ohio State University and also a research director at Nationwide Children's Hospital. And as you can see, he'll be talking to us today about the development and testing of VR technologies for pediatric safety, anxiety control, and pain prevention. Dr. Xiang.
Thank you so much for the introduction. I think this is a natural step for us to talk about the science and data because Xiang actually developed a lot of these games for our studies and we work together so productively. What I want to do to share with you is our experience from even start thinking about, how do we using virtual reality in pediatric safety, anxiety control, and pain, and our clinical trial result, and my view of the future in the science of the virtual reality. So I came from another country. Okay. I have no conflict of interest. Why we are in children and adolescents. I got this picture from my friends in China. You can see they are really having fun, right? So children are really having fun in VR. So my friends, I don't know whether some of you know my friends and colleague, Dr. David Schwabel at University of Birmingham, University of Alabama at Birmingham, has more than 2 decades of research in this area. So what he has done is to use this, the previous version of this virtual reality, trying to change pediatric children's safety, pedestrian safeties. This is a huge sample size, but you can see the conclusion, some change in self-reported intentions, but no significant behavior changes. And then he and I got a grant together from NIH Fogarty International Center and did a study in China. And what we did is to using this phone-based VR for 12 days in their classroom, trying to teach them, the safety behaviors. And this is the steps of those safety features they need to learn. And this actually was built on base of this, based on the actual road across the school. So you can see what they what we have found, even though we have only 56 children participating in the smartphone-based VR improve the pedestrian safety behaviors. If you want to look at the data, you can go there and look at read that paper. So, and then because I worked at the Nationwide Children's Hospital, I have been working together with trauma physicians and nurses, and we did EMS regional trauma care system, and then it come to our attention. Actually, pain is a significant issue among those children. So under treatment of pain has been associated with psychological sequelae, but also there's an important thing here. Anxiety is particularly important to students in the first burn dressing changes, as it may increase over time and lead to long-term pain management problem and psychological issues. We published this paper based on our data from 90 burn patients 6 to 17 years old. We use the STATSI. You can see STATSI, the maximum score is 24 because there's 6 questions and then each of them have 1 to 4. But you can see there's a lot of people, a lot of pediatric burn patients, they have these anxieties. And And we did the analysis. We found out there's a significant association between the researcher observed pain, self-reported pain, and the anxiety scores. VR pain management during wound care is important, as you know. Opioid is a crisis in the United States. If children are using opioids for a long time, they have a risk of being addicted to opioid or long-term use. You can see all these opioids commonly used during the burn care, and then this is the results from American burn centers is disturbing, and you can see, almost every centers are using opioid pain medication to treat patients. It's just the routine treatment. And then you can see anxiety medications also are routinely prescribed. Okay, so they also ask about distraction technology, parent presence, music, and others, and to say, okay, what kind of technology you use during the burn care. You can see distraction technology, including the 2D movies, video games, and other electronic media, and the other includes the virtual realities. But you can see, currently those distraction technologies are commonly used. So because of that, why say, can we actually move some of this 2D video games into the virtual reality? So virtual reality for burn care, we have a designer study based on this attention gateway series. You can see here there's no distraction. And then our series, there's a perceive VR view, the no cognitive node, and there's an active VR game actually because they interact with the game, so their attention, they have the higher cognitive node. Based on this theory, you can see, the effectiveness of VR in reducing the pain score. So
Not a hot mic, right?
this group should have a higher effect than this group and then this standard care groups. So that's the scientific theory behind that. But also, there are other studies. I think some of you in this room know Dr. Hoffman from the University of Washington in Seattle did wonderful studies. Actually, he started this virtual reality research 20 or 20 years ago. What he has found really is the core scientific evidence to show actually virtual reality can change the brain's pain signals and the processings. This is another scientist that showed this in 2020. Showed this here. Oh, sorry. Here is the pen. Here is the VR, and here is the opioid. If you combine the VR and opioid, you should have a better effect. Another scientist also talk about the brain regions that VR can affect. Different regions VR can affect. So advantage of VR-based pain management, so there are a lot of advantages. I don't want to spend a lot of time on that. Back in the old days, people used the computer and this kind of thing. This will not be able to integrate into the clinical practice. Our Nationwide Children's Hospital trying to implement this in 2009, but they gave up because this is not possible for them to integrate into the daily routine care. So what we have found is the smartphone computer, smartphone VR. Smartphone VR has many advantages over the computer VR. So John did this, and John created this game for us. So simple but easy to use. I will show the scientific evidence about the user experience and clinicians' feedback about this VR. So we did a outpatient clinical trial. This is a randomized clinical trial, 3-group between subject randomized clinical trial. We were able to recruit our primary. Originally, we want to recruit 90 patients and random them even into 3 groups. And we were able to recruit 92 people, and there were 31 people in the active VR group, 30 in the passive VR, and 29 in the control group. What is unique in this study, because the active VR and the passive VR, they have exactly the same VR content. The only difference is the children in the active VR, they have interactions with the game. Here is the result. The result, we published this in 2021 on JAMA Open Network. First, we need to find out whether there's a huge difference between the 3 groups at the baseline. But you can see in terms of age, TBSA, anxiety, child expectation, child fun, hopefully, caregiver expectation of fun, caregiver helplessness, and this is burn injury. There's no difference because we use the randomizations. And here is our result. You can see, there's a significant difference between the active VR versus the standard care group in terms of overall pain self-reported by the patient, and worse the pain by the patient. Also, it's very important here. I have typo here. So this one shows those mean scores by distraction type for 67 children should be without pain medications. I double checked with my publications on JAMA 5 minutes ago. I said this should be the case, because if those children did not have the pain medication 6 hours before, this VR should be more effective. Actually, we show that that's the case. In terms of the feasibilities, you can see children are very happy with the VR game. They want to use this again. Caregivers reported a very high satisfaction with our game. And another important thing is to find out, do you have fun? Is our game engaging? Is our game realistic? And you can see we have a high rate of those people in the active VR report. They it's fun, it's engaging. They have this a good experience there. And also, it's very important to get feedback from those clinicians, the physicians, nurses, because eventually they are the person who will implement this. So our nurses and the physicians, they saw this is very helpful, easy to use, and even some of them, after we finish the studies, they say this is very helpful. Why don't you just give me the VR so we can implement this at our clinic? Actually, we did. So we gave them the VR, the Pico Neo, and use that at our outpatient clinic. Our second study is the home dressing pain study. As you know, after those burn patients are discharged from our hospital, some of them still need to use daily burn dressing changes. And some of them use long-term, but a significant proportion of them still need to use burn dressing changes. Why it is important? Because this is the repeat use of the VR. So the hypothesis is, people were got bored, they were give up, they were say this is not really, I'm not happy with, I'm not engaged over the times. But our study actually shows that that's not the case. So realism, engagement, happy, fun, over times, they still have that high level of that factors. And this is when they report the overall pain and the worst pain. Statistically, it's a challenge work actually to compare those two groups because you have repeated measurement. What we have done is to create an innovative scientific methodology to calculate the, some of you in this room knows area under curve, right? Area under curve is basically calculate of the area under curve. That's a statistical concept actually can help us compare those two groups. We found out actually our VR can achieve clinically meaningful effect over 30, is considered clinical meaningful effect. So in summary, smartphone VR was effective in increasing pedestrian safety behaviors among school-aged children. Smartphone VR game was effective in reducing self-reported and observed pain during burn wound care at the outpatient clinic. Nurses also report that VR pad could be easily implemented in their clinical practice. Our at-home feasibility study confirmed continuous engagement of pediatric patients with VR pad during repeated burn dressing changes. In September of 22, we got a large five-year R1 actually to do a clinical trial at multi-site. What we want to do is to recruit 200 children who suffered from the burn and then test our effectiveness and barriers and challenges of implement this VR pad during at-home burn dressing changes. So I'm happy to share with you, we started patient recruitment 2 months ago. We were successful to recruit 4 so far. So I'm very confident we will be able to recruit 200 people in the period of 4 years and then finish the study. For future study, I will not have a time to talk about this. During this conference, we heard a lot of presentation about the core effect, observed clinical effects. But as a scientist, we need to find out what's the next step. The next step, scientifically, I think the field need to figure out not only the distraction theory, but also the neuroscience behind these virtual realities. So I will stop here, and I have 1 minute to answer questions.
Yeah.
We have exclusion criteria, but we do not have that screening tools. And we found out actually the side effect is very, maybe 1 or 2% they reported they have this, better version. And is that your question? We didn't use that, any like a screening tool, yeah. Okay, any other question? Okay. So the question is whether parents worried about the side effect, and no, actually they love this. They encourage us to say, so we want to use that again. So a lot of them, parents are really excited about them. They say this is cool, this is fun. Okay.
Great study. It's very challenging to take care of young patients. For your patients that actually went home, which I think our headsets, I noticed that you had some that fell out. Have you looked at usability studies to see exactly what type of patient education or engagement is required to increase compliance?
Actually, the one thing is the smartphone VR we developed, Xiang developed with us, is very easy to use. They can have their own iPhone downloaded from our site and put that in a VR goggle we purchased and gave them. We purchased it from Amazon and handed it to them when they have the visit at our hospitals. They do not have any problems, so very few people have technical issues. Yeah. Okay, thank you very much.